If you're struggling with lymphedema swelling from head and neck cancer, you're not alone. Swelling in the face and the neck area can be frustrating and uncomfortable, but the good news is that there are effective ways to manage it. I'm Dr. Alex Hill. I'm a double board certified physical therapist, and I specialize in oncology and lymphedema. And in this video, I'm sharing some of the best strategies to help reduce swelling and improve your comfort. So let's get started. First, before you start with any new exercise or program, always check with your lymphedema therapist and medical provider first, because although I am a certified lymphedema therapist, I'm not your lymphedema therapist. Tip number 1 is perform exercises to improve lymphatic flow. Movement is one of the best ways to support your lymphatic system. Unlike the circulatory system, which has the heart to pump the blood, your lymphatic system relies on movement of muscles to help move the fluid. Gentle, repeated exercises called remedial exercises can enhance lymphatic flow and help get that fluid out of the face and the neck. These exercises include deep belly breathing, shoulder movements, and neck movements. For the full exercise routine, keep watching to the end of this video or click the link in the description below. Try to do these exercises a couple times throughout the day to keep that lymph fluid moving. Tip number 2 is perform manual lymphatic drainage, or MLD. MLD, or also called lymphatic massage, is a specialized hands-on technique that helps to physically move fluid out of the swollen area. It's most often done by a certified lymphedema therapist, but you can also learn some self-massage techniques at home. MLD can be effective at facilitating fluid movement out of the face and the neck area, and even if you have swelling inside your mouth. With MLD, the goal is to move that buildup of lymph fluid out of the area and back into the lymphatic and circulatory system. If you need that face and neck MLD routine, I have that linked in the description below and also at the end of this video. Tip number 3 is use compression garments. These are specialized compression garments that can be a powerful tool for managing lymphedema. They help with reducing swelling and can also help with reducing fibrosis, which is that thickening or hardening of tissues due to that lymph fluid buildup over time. Many people are familiar with compression sleeves or compression stockings that are used for lymphedema in the arms and the legs, but there are specially made compression garments that can be used for the face, over the eyes and the upper part of the face, as well as compression garments that can be used around the neck and up onto the face. There's a lot of different ones on the market. This one is a pretty popular one and it's easy to use. It has it labeled for the top of the head and the back of the neck. And so what you can do is loosen that Velcro up, and then you'll place it around the neck first, and then you'll pull that up and around the top of the head, scooch that down, and then you can adjust it to make it more snug against the neck and the face where you need that compression to decrease that swelling. And you can see on the inside of this garment, there are channels here to help with moving that fluid. You can also see that it's quilted and it has some irregular foam pieces within it. And what that does is it helps to break down any fibrosis and really help to soften those tissues. And they've really improved the materials over time, and now they are a lot more breathable. They don't get as hot and stuffy as they used to be. Most people can use these standard size compression garments, but if you have any irregular shaped neck or face, or you have something specific going on where this doesn't quite fit right, then you can get a custom garment made by working with your lymphedema therapist. Because swelling in the face and neck typically gets worse overnight when you're lying down, it's best to wear these garments while you're sleeping or resting. I recommend gradually increasing the time that you use the compression garment, since it can take some time to get used to. You can try initially just for an hour or two and then gradually build up that time to be able to sleep overnight with it. But finding the right compression garment can take some trial and error, so to be sure to work with your lymphedema therapist to get the right fit and style for your needs. Again, this is just one example of a couple that are on the market. Tip number 4 is optimize your positioning. The way you sit, sleep, and move throughout the day can impact your swelling in the face and the neck. Making small adjustments to your posture and positioning can help prevent fluid from pooling in your neck and face. First is elevate your upper body while you sleep to help drain the fluid. Sleeping with your head elevated can help prevent fluid from settling in and pooling in your neck overnight. So you can try bed risers at the head of your bed, or if you have a bed that you can change the angle of the mattress, just simply bring that head of the mattress up. Or another easy way to elevate your upper body is using a wedge pillow or some extra pillows to elevate yourself up. Next is to bring up whatever you're reading. So instead of looking down at your tablet, at your phone, at your computer, at your book, bring those items up to eye level so that you can look at them straight on. If you're looking down the whole time, all that fluid is just going to pool towards the front of your neck, versus if you bring that book or whatever you're reading up to eye level, that's going to help with making sure that that lymphatic fluid can continue flowing normally. And finally, try to avoid prolonged forward head positions where you're sitting or standing like this. Always try to maintain an upright posture. Again, just like when you're looking down to read something, we want to make sure that we are staying in an upright posture, chin slightly tucked back to help with that lymphatic fluid flow. These simple adjustments we went through in this video can make daily life more comfortable, help prevent swelling from getting worse over time, and if you're in the active phase of reducing your swelling, can help reduce your swelling and improve your function and different things you might have difficulty with, like hearing, swallowing, or speaking. Managing head and neck lymphedema does take a combination of different strategies, but with consistent effort, you can make a real difference in your symptoms and swelling. I hope you found this video helpful. If you did, please give it a thumbs up, subscribe for more cancer rehab and lymphedema tips, and drop a comment below with any questions or your own experiences that you'd like to share. Thanks for watching.